Hello, this is Dr. Gay from First Look MRI, and this is a 67-year-old female who jammed her finger recently, has lots of pain and swelling, and she has this locked position of the finger. She cannot extend it. This is what we call a boutonniere's deformity when it's locked like this, and she has soft tissue swelling about the finger. When we do the MRI scan here to see if she has a ligament or tendon tear, we see this T1 weighted image, a sagittal view, and we can see the distal phalanx, middle phalanx, proximal phalanx. We see this boutonniere's deformity here, where we have flexion here, and a little bit of extension here. And we see one of the problems. This is the flexor tendon of the fifth digit. It looks intact, which is great, but it's pulled away. There's a big gap. Normally the flexor tendon will hug the bone, but it's stripped away here. And there are pulleys that hold this flexor tendon tight, and the pulleys are torn. So this is a pulley injury, is one of the problems. And there's a, we call the A2 pulley is right around here. So part of the A2 pulley looks like it may be intact, hugging it close, but maybe the distal portion is torn. And we have a smaller one, the crisscross one called the C1 pulley. Somewhere in here, it looks like that's probably torn to allow this to really drift up so high. And then there's an A3 pulley over here, and it looks like that may be torn as well, because there's a big gap between the head here and this. So it looks like they have a pulley mechanism injury where the pulleys that hold this to close to the bone are torn. And it may be enough just to say that there's a bowstring deformity. It looks like a bowstring when it's pulled away like this, indicating a pulley mechanism injury. But if you want to get fancy again and think about the annular pulley, the A2 is the one that's usually torn. Again, it is in about this region. It looks like the distal end may be partially stripped. The cruciform pulley, number 1, C1 pulley, these two small oblique strips that go across, that one's definitely torn because it's right in this region. There's a big gap. And again, that A3 pulley is around the joint here. And so maybe the distal portion is intact because this is hugging, but maybe the proximal portion is torn. And now there's one other finding here. The flexor tendon is fine, but the extensor tendon, we're looking for that. It looks like it comes up here. The middle portion we call the central slip. And it looks like the central slip comes up and fizzles out right there. So it should attach over here. So you have a ruptured central slip. And when that's ruptured, the joint capsule also is torn, and that's why we get this subluxation. This is a sagittal PD fat set sequence. We can see the same things. Again, we do not see the central slip. It is ruptured. Again, that allows for this subluxation and contributes to this bowstring deformity. There are also lateral bands, so the central slip's in the middle, but if we go off to the sides, there are little lateral bands. This may be one of them here, and maybe this is another one here that's flipped underneath. And this lateral band looks like it may be intact, and that'll go over here distally. So ruptured central slip with subluxation, boutonniere's deformity, bowstring deformity of the flexor tendon, and a significant pulley mechanism injury here. And thank you very much.